Recent clinical experiences with Tibolone among Asian women have shown promising outcomes in smaller randomized studies. If you want to deep dive into Tibolone's short and long-term safety and effectiveness, watch part 1 of this video. Now let's get back to the key observations of Tibolone in Asian women. Tibolone demonstrated greater effectiveness than conjugated equine estrogen and medroxyprogesterone acetate in alleviating symptoms measured by the Greene Climacteric Scale, and it resulted in less vaginal bleeding. Both Tibolone and CMPA were found to preserve cognitive function based on assessments like the Cognitive Abilities Screening Instrument and the Mini Mental State Examination. Tibolone significantly improved sexual function, reducing issues like vaginal dryness and painful intercourse compared to CMPA. Tibolone's effects on lipid profiles were mixed, showing reductions in total cholesterol, triglycerides, and HDL cholesterol, with a slight increase in LDL cholesterol. Tibolone noticeably enhanced lumbar bone mineral density, unlike CMPA. Its impact on lipids suggests a complex relationship with cardiovascular risk, showing some benefits alongside potential drawbacks. While increased stroke risk was noted in the LIFT study, it may be less relevant for Asian women, who typically have a lower incidence of stroke and fewer related risk factors. Tibolone may be preferable for Asian women with dense breast tissue, as it does not significantly increase mammographic density compared to other hormone therapies. The expert panel for use of Tibolone in Asian women underscored the need for additional studies on Tibolone's effects on the musculoskeletal symptoms, as this is one of the top menopausal symptoms in this group. It also called for long-term data on cardiovascular outcomes and endometrial cancer. Though randomized trials have not indicated an increased risk of hyperplasia or cancer with Tibolone over an average of 2 years, some observational studies suggest a potential rise in endometrial cancer among users, which may be influenced by pre-existing conditions or prior HRT use. Additionally, there's a gap in published data regarding Tibolone's effects on diabetes and stress incontinence, as well as studies assessing its impact on breast cancer risk. The panel recommends investigating the efficacy of lower Tibolone doses for this demographic. Finally, the expert panel identified specific Asian women who could benefit from switching to Tibolone from HRT, particularly those facing increased breast pain despite dose adjustments, increased breast density leading to unreadable mammograms, low libido, mood disorders, ongoing bleeding issues without histopathological reasons. In conclusion, Tibolone presents a valuable option for managing menopausal symptoms in Asian women. But further research is essential to address specific health considerations and to optimize its use in this group.
Always speak to your doctor first before starting, stopping, or changing your medications.
Thanks for tuning in. If you found this video informative, please give it a thumbs up, subscribe, and share your comments or thoughts below. Catch you next time.